if you look at infertility risk and the rates of obesity in the United States, you can see that they're closely correlated.
Having seen so many, I'm guessing labs, you mentioned infertility being on the rise. And I'm just kind of curious about that. Like, with everything you've seen, what are some of the big reasons why that's on the rise? I'd assume maybe it's something within lifestyle, or are there deeper reasons why that's a problem?
The answer to this one is all the above. So people have lots and lots of different theories of why infertility is becoming more and more prevalent. One of the easiest things to target is metabolic syndrome. So when you have different things that are inhibiting your pituitary function, then spermatogenesis can be problematic, and ovulation can be problematic as well. So insulin resistance is, of course, correlated with a condition known as PCOS, which is a continuum of androgenic activity and insulin resistance and polycystic ovaries. However, the same processes that are causing that can also cause infertility risk in men. So if you look at infertility risk and the rates of obesity in the United States, you can see that they're closely correlated. Not necessarily directly causatory in some circumstances, but definitely correlated. And then, of course, you have the debate, which there's weaker evidence for, but theoretically could be playing a part, is toxins in the environment.
What is polycystic ovarian syndrome? I hear it a lot. I've heard a lot of women in my life talk about it. And how can someone potentially, I guess, rid themselves of this? I don't really know exactly what it is.
I could be wrong too. I hear about it a lot amongst like really fit women.
Yeah.
Am I?
Yeah, so do I.
Yeah?
Yep.
Okay.
Yeah. So PCOS is a group. It's really a continuum of many different conditions that often cause hyperandrogenic side effects. So in women, a lot of times this would be, hair growth or even beard growth, acne, male pattern baldness even, and then high free testosterone, low sex hormone binding globulin often, high LH to FSH ratio, often greater than 2. There's a couple different theories of why some people get PCOS. Some people likely get PCOS just because of a hormonal condition. For example, hyperthecosis. The ovary has specialized cells called theca cells that can secrete androgens. And for some reason, women have very high levels of this. I believe this has been talked about pretty often with the Olympics. There's several elite female sprinters.
Right.
XX sprinters, and they just have high levels. So that those people are very high risk of developing PCOS.
Guys, you need to get your blood work done. But I know that when I've gotten my blood work done in the past, I saw all the things on the sheet and I had no idea how to interpret it. That's why we've partnered with Marek Health. Not only do they have a panel that has everything you need for men and women, it also comes with an expert analysis from a doctor where they'll tell you where you're deficient and how you need to fix it. Andrew, can you tell the people how to get it?
At marekhealth.com/powerproject. You guys will see the Power Project panel. And again, this includes a written report as well as a one-on-one consultation with a real doctor. That's at marekhealth.com/powerproject. At checkout, make sure you guys use promo code PowerProject for $101 off. Head over there right now.
So there's also other causes. Some cases of PCOS are likely just related to metabolic syndrome. Excess calories over time causing hyperinsulinemia. So there's cases in between as well.
How's it usually treated? Like, is there like supplements or get more sleep, or is there something you can do to kind of rewind the clock and not have it anymore?
Yeah. So it's completely reversible in most cases. Some are significantly more resistant. The mainstay of treatment, so it used to be 10 or 20 years ago, you'd go into your family physician and they'd say, diet with caloric deficit and exercise. And that was pretty much the treatment. Metformin is used often. For fertility drugs are used often. For example, letrozole or Clomid. But if fertility is not currently desired, oftentimes different things that help increase sex hormone binding globulin, because the more androgenic the steroid, the endogenously produced steroid, the more strongly it binds to SHBG. And
this is where
PCOS patients.
This is where tren comes in, right?
Well, it's not treated with tren, but oftentimes it is treated with derivatives of androgens that are birth control pills. So, synthetic estrogens and progesterones, and that synthetic estrogen will have a effect on the liver that causes the liver to secrete more SHBG, which decreases your free androgen index, decreases your androgenicity, and thus your symptoms. So it's symptomatically treated. It's kind of the same concept. Sometimes we treat them with spironolactone, which is a diuretic. It's actually a mild anti-androgen as well. And again, that's a symptomatic treatment.
No. Oh, go ahead.
No, I said, just what about on the other side for male infertility? Like, I do have people that are close to me, and that are trying, and I off the top of my head I can't remember who's who, like, or who is gonna need treatment first, but I had mentioned, I'm like, hey, well, like bro science, it's like HCG and Clomid, and a traditional doctor, he's just like, no, like don't do that. But I'm curious, what is some treatment that you can recommend, or that maybe somebody should kind of research and kind of peek at when maybe their swimmers aren't as strong as they should be?
Yeah, with men, it's situational. So as you mentioned, in some cases, HCG and or Clomid could be helpful. It's important to get a good diagnosis of why the infertility is happening. So in about 1/3 of cases, it's what we call female factor. In about 1/3 of cases, male factor. And about 1/3 of cases, it's combined or third factor. So you basically work up to see, is it mostly female infertility, male infertility, or just a combination of the two? So that includes lab work. Occasionally that includes imaging, whether it's ultrasounds or HSGs, things like that. But often male infertility, you can find a cause and treat it. So there's several other things that you can do. And there's lots of studies, as I mentioned, with females. The myo-inositol or obostatol is a supplement that lots of them use. With males, L-carnitine is, because it helps with sperm motility, is what many men use as well. So to answer your question directly, there's lots of different things that you can do, but it depends on the etiology of the infertility.